Welcome guys and girls again. My name is ABDIKHALIK Mohammed. Today we shall have the second class of public health course, and today our class yes, of course, our class will be foundations of public health. As I told you on last video, we shall start with the first course will be public health foundations or foundations of public health. It's the same like introductions to public health. We shall have the second classes. As I told you, we shall concern more and more on epidemiology and by statistics. So foundations of public health will be today will be our class of foundations of public health. Let's start. Uh, before before we enter on the first to learn the word health, we know what means public and we know what means the health. So now, what is health? According to WHO, uh, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, what is WHO? World Health Organization. It's same as SDC, Centers for Disease Control and Prevention, but WHO is the largest organization or largest agency for health. Actually, it's from United Nations. It's well like as UNHCR, UNICEF. They are all agencies or organizations which are from United Nations. So WHO says that health is a state of complete physical, mental, and social well-being. What does this one mean? Let's see on this photo. There are three components of health. That's physical, social, and emotional. For example, physical, how health your body is. You are complete. You don't have problem on eyes. You don't have problem on hands. You don't have problem in the body. That means your physical health. If you have any problem with the hand, the leg, or any part of your body or any organ, then you are physically sick or you are not physical health. Social is ability to have this just example as the ability to have health relationships. Like for example, how many calls do you receive per day, either WhatsApp or direct calls? How are you communicating? Even if you don't have, how are you related with your population? With your population, that means you are social. You are socially active. If you are socially inactive, that means you are sick. You are socially sick. You may be healthful in physical, but still socially you are sick. You must talk to the community, and also community to respond you back. You have to receive response from the community. You talk to someone, you tell him something. So you talk to other person, you tell him something. It's that you communicate with your population. That means you are social, healthful. Emotional, it just means what's running on your head is emotional. What's running on your head is emotional. One day you are feeling sad, one day you are very happy, one day that just mental. If you have some issues on mental, like family problem, that means you are mentally sick. You are not healthful. We shall have more discussions on second classes. You can fill on this one is you can fill on this ones. By the way, if you want to receive these notes on email, you can leave me as a comment your email. I just transfer you direct, or otherwise you, as I always tell you, I can give you here my WhatsApp number, and you send me or you communicate with which I can send you direct on WhatsApp. This is my WhatsApp number. On this WhatsApp number, you can communicate. This the code for Uganda, and this is my personal phone. So that is if you want to receive this notice. This is health. This according to WHO, they define health like that. That physically you are healthful, mentally you are healthful, and socially you are active. That means you are health complete. But if you miss any of that, you are sick. Let's go now direct to public health. Let me just minimize this chapter. Let's go directly now to public health. What is public health? Here we have a definition says that public health is the sum of all official or governmental efforts to promote, protect, and preserve the people's health. We shall see health reservation, we shall see also health preservation and health sufficiency. But public health is saying that all efforts of the government, all efforts just to promote and protect and preserve the people's health is public health. But that definition is a bit good, but we have a better one than that one. This Winslow definition of public health. What is public health? It's saying that public health is the science and the art of preventing diseases, prolonging life, and promoting physical health and efficiency through organized community efforts for the sanitation of the environment, the control of community infections, the education of individuals in the principles of personal hygiene. That is Winslow is defining now public health, saying that public health must have a triangle. Let me use this paint to explain much. Let me just get this triangle. He's saying that public health has three parts. The first one is preventing disease, prevention of disease, preventing disease. He's saying that public health itself, the first part is to prevent disease. And we have that proverb sheet says that prevention is better than cure. Instead of getting hospital, said that you get treatment for tuberculosis. It's better for you first you prevent yourself not to get tuberculosis. Instead of going to hospital to get treatment for TB, it's better you prevent yourself first from tuberculosis. And in order, let me just I wish this one at least you could see because the video is recording from the screen. Sorry. Preventing disease. Must be both. Preventing disease is first part in public health. Preventing disease. Then I saying that prolonging life, prolonging, prolonging prolonging life, prolonging life, and also promoting health, promoting health. This is how Winslow shows that you prevent disease from yourself first. You can buy mosquito nets to prevent you not to get malaria. That one is better. But in any case you get malaria and you never get a chance to buy a mosquito or you cannot afford to buy mosquito on that time or it was not possible to get for you mosquito net and then the mosquito comes and bites you until you get the malaria, then you are positive in malaria. In epidemiology, we shall have true positive, negative, true positive, false negative, true positive, false negative, and also those are together, and true positive, false negative, and it is true and false. So either you are true positive, that means you have the disease, and also true negative, that means you don't have the disease. And also there is false negative, that means you have the disease, but the negative results are wrong, but you have the disease. That's false negative. And there is also false positive, that means the machine or the lab shows that you have disease, but you don't have. So that's false positive. All those is screening we shall see on epidemiology, I think. So preventing disease, prolonging life, and promoting health. If you don't get a chance to buy mosquito net to prevent your disease, to prevent yourself from malaria, uh, then you go on hospital, you are true positive on malaria, you'll go this step, you'll go this step which is prolonging life. That means you get treatment against uh, the plasmodium, which is the plasmodium is what causes the malaria. So you'll get treatment against that plasmodium, said that you don't get, said that you get treated from the disease and you prolong your life. Otherwise, if you don't get treated, you may die on your own. And you, as example, just but it can be any person from the community. That's prolonging life and promoting health. Sorry, here promoting. I'm missing your O. Promoting health. Promoting health. Let me first give you some examples here. This is the mosquito net. So this person inside in the mosquito net is not exposed to malaria. Me now, right now, I'm exposed to malaria. Anytime the mosquito may come and bites me from here, for example, because I'm in an open area, I'm not in the net. So now I'm exposed. We shall see on disease expression uh, in epidemiology. Epidemiology 1 we shall see, epidemiology 2 we shall see. So now I'm exposed to get malaria. But this person inside in the net, this girl, she is not exposed to get malaria. And not only malaria, but she is now not exposed to get diseases related with flies, mosquitoes, or all those insects which may move. She's now preventing herself from getting disease. That's the first step of public health. And in every and each course and in each and every video, we shall have this one is especially these two. What is meant, especially these two, preventing disease and prolonging life. These two we shall have in everywhere. So this person here is not exposed to malaria or such diseases because it's now prevented. That's the first photo. Let me go to second photos. Let me this the zoom. This lady also have, this girl may have diarrhea. Then how can we prolong her life? The other one was preventing disease. The other person which was in the mosquito net was preventing not to get malaria. Now, what about this person which has already have diarrhea? To prolong her life, we shall give this one is this yellow banana, this bread. We give all this one and say that this one works naturally, quickly, and effectively. So this is prolonging life. He has already infected with diarrhea. The infection has already reached her body. So she takes this one and said that she get prolonging life. And promoting health may be, for example, this is just a book, but for example, this person is happy. This kid is also happy. These people all their attention. These people all their attention is forward to teacher or lecturer or for example they are all in class, of course, so all their intention is to the lecturer. So the what this promote this one is in this is like social well-being, as we have talked about physical, mental. This is like social, so it's health promoting. Now that was introduction to public health. Winslow shows preventing disease. It's saying that we use all the science and the arts we have, social or science and art, all the science and art activities we have or resources we have. We shall use or mobilize them such that we prevent disease, we prolong the life those which have already injected with diseases, and promoting physical health. You will receive this one on email. This notes you read on your own several times. So now here public health is about achieving health for all members of the population. Public health is not like you open a hospital and you treat specific people from a specific area. No, that's not public health. Public health is about achieving health for all members of the population. I think in biostatistics we shall see, and dynamics, population dynamics. In those courses we shall see how to calculate the mortality and morbidity like how many people die if each and every year, and how many people get falling sick of a certain disease, maybe in tuberculosis, how many people are having lung cancer. With those ones we shall see on population dynamics. So those calculations, how to calculate the average all. That's health for all members of the population. That's the achieving goal of public health. Here, public health therefore shares some ideas as primary health care. So now, what's primary health care? Before I read this one, I want to first just see on here on primary health care. What is primary health care? Primary health care refers to essential health care that is based on scientifically sound and socially acceptable methods and technology, which makes universal health care universally accessible to individuals and families in the community. What does public primary health care means? BHC. BHC means uh, essential health care. Essential health care. It may be they also call fast health care. So now, for example, if I get a problem in the stomach or I get stomach ache, I may request someone to get for me a juice from lemon. You get buy some lemon from the market, you use to cut, then you get the juice, you mix with water and add some small salt. Some people add, but mostly they add sugar. They add some small sugar. Then they bring for me 1 cup of lemon. Then after I said that, I at least reduce the pain from the stomach. That's the primary health care. It's the first health care they give to the person. That's the first health care they give to the person. That's essential health care. So it means it has criteria where it is socially acceptable. If you get, for example, if you get problem in stomach, as I've said, I cannot take 1 liter of petrol so that I get, because it's not socially acceptable. The petrol itself can be treatment for the stomach ache, but it's not socially acceptable. So primary health care, it must be socially acceptable. And the technology here is, it may be the knife you use to cut the lemon, maybe the technology. That's a very simple example that the first health care they can give you, which is possible, the technology is available, that's primary health care. So it's saying and social active method which makes universal health care accessible to individuals and families in a community. It must be accessible, it can be reachable. Accessible means here reachable, it can reach to everybody who is in need of primary health care. So we shall have a full course, a full video or full lecture or full class about primary health care. But that's primary health care. For example, here this has photo public ambulatory care facility in Venezuela. This photo is in Venezuela where they are providing or provision of PHC, primary health care. Let's go back to the class. This is primary. So it's saying that public health therefore shares the same ideas as primary health care. They are remembered as the four awards. The four awards, that's affordable, acceptable, accessible, and appropriate. So affordable means just costing. I have an example. I heard that some doctors who used to treat Ebola from people, I wish it was Congo, but I'm not sure, get infected with Ebola. The doctor get infected with Ebola. A certain airplane has came, the doctor was American, I wish US so. A certain airplane came and took the doctor to US. They put him in hospital, they put him on the bed and came with spraying in his brain system, and they sprayed the doctor. They sprayed him all. They may use like 1 hour for spraying him. And after 6 hours, he came out when he is not having the infection of Ebola. They took him to screening or testing, and then the results shows he's negative. He's not doesn't have the Ebola. And when he was in the field where they are treating, he was positive. And when they took him back to where there is a good health service, he came out well. So there we shall have an example, because if they have that treatment of spraying for all, they could bring it. But it's very, very expensive. It's very, very expensive. They cannot afford to provide all those communities which are just infected for such spray. They may make that one for the doctors or special people. So for the other people, they give what they can afford, maybe tablets, maybe injection. So the health service treatment, health service may not be affordable in a certain community. And for if you go now, for example, if I may go to a pharmacy and I get malaria, they can give me 4 different tablets. Me to choose, this is $3, this is $5, this is $1, and they're all against malaria. They may not in the same quality. Then it's up to you to choose what to buy. That's affordable. How much money do you have to buy any health service or to buy a medicine? That's the affordable, acceptable. If you get, for example, headache, and you go to hospital or you go to any pharmacy to get some tablets, they cannot give you amoxicillin, they cannot give you tetracycline, they cannot give you antibacterial treatment tablets. Yet if you have just a headache, they have to give you paracetamols, penicillin, those painkillers, but they cannot give you they cannot give you tablets for example, for malaria, as I've said. They cannot give. That's acceptable. It has to be something acceptable. Accessible is someone is sick in the village, and it's how many kilometers is the where the patient is, and where the hospital is. Within epidemiology or within foundations of public health, we shall see health center 1 up to health center 4. Health center 1, health center 2, health center 3, health center 4. Those are health for health centers. Health center 1, they are also called village health team. After this one, the next step will be hospital, general hospitals. Then after general hospital, it's just general hospitals, then there's also regional referral hospital. Is that region or that region, the biggest hospital in that region or in that district is regional referral hospital. There is also national referral hospital. For example, Uganda have only 2 national referral hospitals. That's Mulago National Hospital, and Butabika National Hospital. Butabika especially is for mental cases. Those are national referrals with that big, they have big services. They can serve thousands and millions of people. Those are national referral hospitals. They may also be international referral hospital. For example, in Uganda, if you don't have some healthcare services, they may send you to India, or you may go to Malaysia, you may go to Germany to get a good health service. That's international referral hospital. So accessible is the point where the victim is, and the patient is, or the victim is, up to the point where the health service is available. It may be health center, it may be hospital, it may be national hospital, and so that's accessible. And appropriate is something like relevant. It may be relevant on time, like a pregnant woman, she's in last week to deliver, then you cannot plan that after four weeks or 5 weeks you will take to hospital. That one is not relevant. You have to plan in last week, it must go to the health service, or it may go to hospital, may go any health center. That's something relevant. That's a primary health care. Uh, Here they have in modern health community. Yeah, this one you can read on your own, but let's go to health community. A health community is one with a visible commitment to achieving the health and well-being of individuals, families, and very groups of people. This is very simple English. You can read on your own and you understand. Let's go down. These community health activities are those that aim to protecting and or improving the health of a population or community, and also maintenance of accurate path and desk records, protection of the food and the water supply. In this one, we may see incommunicable and non-communicable diseases. We shall see food and the water supply, how they may affect the population, In those courses, we shall see which is in like in semester 4, semester 3, we shall see communicable and non-communicable diseases. We shall also have emerging and re-emerging diseases. We shall talk about them more. Public health looks at patterns of diseases, environmental hazards, models of health, services delivery that will result in adequate levels for the largest number of people. Uh, Public health looks at environmental hazards. For example, when there is earthquake, it may cause a lot of problems. Not only health problems, may also economic problems. Earthquake may fall buildings down, like always what happens in Japan. And what the earthquake happens not only affect on the health, it also affect on economic, social, all. So it looks environmental hazards. Um, Okay, let's go now. What the goals or the missions of public health? What are the goals of public health? The goals to achieve. The first one is to secure adequate health for the majority of population. And if we cannot provide health, for example, whole people in Uganda, at least we secure adequate health for the majority of people population, which like in Kampala is holding 6 million people. It is then nearer cities or all big cities we provide a health service so that we get at least the majority of people to what to have to be a healthful to get adequate health. Adequate health means if you get for example injured here, at least you get iodine and some antibacterial. At least if you cannot go for you cannot go for surgery, at least you get a treatment for there. That's adequate health. Personal health activities include individual actions and decision makings that affect the individual or his or her immediate family members. Let's go down community medicine. This usually refers to the services that are provided at the community level and is now often encompassed in the new term primary care. All this we shall have, as I've said, primary health care. And now, what does public health deals with? Public health deals with the health of the whole population. It's the same for health for all or for majority of the people. They are all making the same meaning. Means that public health is just dealing to make sure this population is healthful. So now let's see public health professional. You as a public health worker, public health practitioner, public health lecturer, public health learner, any public health. Here, where you focus, public health professionals. What are public health professionals? Public health professionals, the aid of public health programs, work to improve the health of the population. They are all making the same meaning. And now we have seen health for all members of the population. We have also seen adequate health for the majority of the population, and now we are seeing improving the health of the population. The health professionals have responsibility to improve the health of the whole of this population. The concept of the public health are same as the community health. Community health, public health, they are making the same meaning. Is what he means here in the note. How do people physically reach the health service? I think this one I've talked about, but in this called the access to the health service. It is especially important in the areas with no clinics or having bad roads or no public transport. Someone in the rural area, like how can he or how can she accessible to the health center? Someone is in a rural area or someone is in the bush area or someone in a small village. How will he reach to the city or how can he reach where there is urbanization, so that he get a health service? It may have no clinic where he is now, maybe no clinic, maybe have bad roads, no public transport, all those things. Now it's affected by the distance people must travel and the ease and cost of the journey. Someone, for example, is in a far area, he may pay a lot of money to reach the health center. Now there are some questions you need to ask yourself as you're watching this video person. You ask yourself, are the health services are accepted by the people? The health service available in the hospital in your area, do people of your area accept that health service? You ask your own and leave me an answer on the comment. The service should be friendly and have short waiting time. For example, when you are going for health service, you have no right to wait like 6 hours or 8 hours. At least you wait for 30 minutes. That's why he said here short time minute. A short time, short waiting time. The time you are waiting must be very short, not much. The health service deal with the right problems. You have a hospital in your area, you ask yourself, the health service there, is it the right one for the problems that the population have, health problems that the population have. You ask your own self and you get the answers. Yeah, the services are appropriate, the health services fail available to everyone. All these questions you ask your own. Let me go down. Mm, In the most countries, there are subgroups of the population that have found it difficult to access health services. This one is true. He's saying here example, but let's see this one. People who don't speak the main language may not attend. For example, in Uganda, that we have 53 different languages from different communities. So if someone is from another village which he doesn't know maybe English or Swahili, those popular language. He does not know. He knows his own local language, and he comes to the city and want health service. He may not get the service because of language. So from there, he may need a translator. He may need an interpreter. All this will ask you. You ask your own community health care, primary health care. All these are questions and discussions you need to ask on your own and get me back on either email or either comment. I will reply to you. All this. Somewhere I wanted to just point it. Uh, Community organization, individual behavior. We are about to end, but all this you read on your own. Yes, beliefs, traditions, and prejudice. The beliefs, these beliefs, some people they believe when the kid, the infant, comes out from his mother's womb, come out like this, they get a razor blade or knife, then they use to cut on his stomach, make some lines. They believe he may get health forever. Those are beliefs in the communities. You find in different communities having lines here, having on the body, but there are also, I mean, like on the face where you can see, but there are also people having inside on the body, because those are the beliefs. Those are the beliefs. If someone get those, some people they get sick, then they take only water is where they think they can get from health from. Those are beliefs. So on this one, you read on your own, then you get me back on email. This is our first class today. This is our first class today about public health. This was just foundations. We shall keep. I shall keep giving you lectures about foundations of public health until we reach the end. And the second classes will be epidemiology. What to do if we have today foundations of public health class, then next day we have epidemiology. The next day we have a statistic. We shall move like that. I will not first focus on only one course and I move forward. I will have a lecture of this one, then the next one, then we shall come back for the other class. I think I understood all this. If you have any much questions, you leave my WhatsApp as I've given you the first time. Or today I have given you also my WhatsApp number, or you get me on email, or you leave me your email on the comment. All where I want to get you so that you understand. This course is totally free. It does not cost any money. Thank you for watching this video and nice to meet you too again.